Welcome back. Rounding out the remainder of the show, continuing our conversation with Dr. Mehmet Oz. So very quickly, Dr. Oz, Tylenol does not cause autism.
Taking Tylenol chronically while you're pregnant could cause autism.
Okay.
I don't think we should mislead people on this issue at all. I don't believe, based on the research that I read, most recently a large study from the Harvard School of Public Health last week of August published, you would not want to take Tylenol unless you really needed to take it. What does that mean? It means in pregnancy, don't take stuff if you don't have to. And if you need to take stuff, talk to somebody about it, like a physician you trust, and then, of course, medicate yourself accordingly. But pregnancy is a very delicate time.
Very delicate.
And there are very few medications that you can really be comfortable taking. Even acetaminophen, the company itself says we're not advocating that you take it. But it's the only thing out there. So if you've got a high fever,
consult your doctor and read in on that. Okay. You're head of Centers for Medicare and Medicaid. Medicare fraud, two components: foreign actors and then large institutional healthcare providers in this country. United Healthcare is in the barrel on this civilly and criminally. What are you doing to deal with it? How big a problem is it?
It's a very large problem. Let's take the criminal actors first. There's large multinational syndicates that have been able to defraud the U.S. government. Why? We're a massive
We're
target.
talking about billions of dollars.
Oh, $15 billion was the last action we had with the DOJ recently. And just to explain what goes on, you need a Medicare beneficiary number, which everyone over 65 has, and you have a $1.7 trillion piggy bank, a piggy bank that's twice the size of the Defense Department. So all you need to do is that number to pierce the system. And if you're sophisticated, and these multinational criminal organizations are very sophisticated, they start to draw down money. They pretend they're sending out wheelchairs. They send drug bills that aren't legitimate. They pretend people are alive who aren't. They manufacture expenses. They collect all that money and get it offshore. And as soon as it leaves the country, you can't get it back. So the group that we busted, the $15 billion bust, the criminals are mostly back in Russia. There's a large syndicate that's doing hospice fraud. I'll give you one that's going to blow your mind. Durable medical equipment. That's the knee braces, some of these skin bandages. There's more DME suppliers in South Florida than McDonald's, I am told. I mean, are you kidding me? Now, these
DME, durable medical equipment.
Durable medical equipment. They're selling you braces and wheelchairs. So these folks start the companies, then they flee back to Cuba. So we never actually can catch them. We want to change the system. We want to do two things. One,
AI does that how?
Bingo. AI can tell us ahead of time based on patterns of spending. People who've never spent money suddenly spend a lot. You open a bank account. You don't have any inventory. You don't have any payroll. You're sending huge bills into Medicare. What gives? So we can identify fraud as fast as the fraudsters create these schemes and shut them down that rapidly. But we are aggressively pursuing these. Same thing, by the way, if you're looking at inappropriate billing or upcoding, all these little games that are played, we can now do exactly what the large companies have been doing in other walks of life. The same techniques banks use to catch fraud, we're starting to use. And we have a fraud war room that's just wonderful.
United Healthcare, Medicare Advantage. I know you're an advocate of Medicare Advantage. That someone takes advantage of Medicare Advantage doesn't mean Medicare Advantage doesn't work. Yeah. But United Healthcare is in the barrel.
They are, and they've come and spoken to just about everybody about the changes they're making to their company. But I'm interested in something much bigger than that. I want the ability of the Medicare beneficiary to choose the coverage they want, and I want whatever coverage they desire to be the right coverage for the American taxpayer, too. They should be affordable. They should be efficient. The most important thing we do at CMS and Medicare is provide high-quality care, and here's why, Major. The most expensive care of all is bad care. Because I pay someone to do a bad job, then I pay someone to fix that bad job, then I got to pay for the complications. So we're interested in quality. And I want to go after every one of these groups, the traditional Medicare, the Medicare Advantage, even Medicaid. We should be providing better quality care. And part of what we did in the One Big Beautiful Bill was to make it easier for us to root out the fraud, waste, and abuse in the system and just focus on providing the most money at the point of care. Get more primary care doctors taking care of patients. And the best example is the $50 billion that we're putting into the Rural Health Transformation Fund. That's twice as much money as currently spent by Medicaid in rural America. If you live in rural America and you're watching this show right now, your life expectancy is 3 years shorter than your fellow Americans watching in urban states. That's not right. Your zip code should not be your destiny. We're fixing that.
Medicaid. I'm well-versed in budget politics, Dr. Oz, to know that a reduction in a future increase is not a cut classically defined. But that doesn't mean someone might lose a benefit that they're currently enjoying, and it's cold comfort to them to be told it's not a cut. What is it? What happened in the big, beautiful bill to Medicaid? Because the political argument is it's a ravaging, damaging, gutting cut to Medicaid services.
The truth is that we're spending $200 billion more in Medicaid. And to your point, what was designed was to take us back to a peacetime. What Medicaid spent 50% more money over the last 5 years because of COVID. All the rules that were changed to accommodate the national emergency, our war on COVID, needed to be reversed. We're not at war anymore with the pandemic. You can't keep spending money the way you would during a pandemic. Let's provide the right incentives to go back to the way the system worked just 5 years ago. We didn't go back 25 years. The one difference, the one thing I feel passionately about is this country thrives because it works. When Medicaid was founded 60 years ago, it never crossed anyone's mind we would not ask able-bodied individuals to be on Medicaid or to work if they were on it. Every social network safety net program has work as part of it. President Clinton had that, Obama, Clinton, Biden, every Republican president. So we put a work requirement in to encourage people to get out of the house and get to work and live your life's destiny. That's what you're on this planet to do to change the world.
Dr. Oz, I appreciate you coming in. May the conversation continue.
God bless. Same.